This is legislation that deals with life. And this is a great, great hospital that we're standing in front of. Mount Sinai has been on the west side of Chicago for very many decades, and it does a great job for the healthcare needs of people on the west side of Chicago. It provides employment to literally hundreds and hundreds of people. It has a big and deep heart, and it's important that we acknowledge how important our hospitals, all of them, are to Illinois. We want to have a strong economy. It means we must have good medical care. And it also means that when emergencies come up, as they do in life, you can't predict everything. Sometimes unanticipated emergencies happen, and we've got to have emergency vehicles and personnel on these vehicles that can save lives. There's a passage in Scripture that says if you save one life, you save the whole world. And it's very, very important that we do everything we can in our state of Illinois to make sure that when there is a life-saving emergency, that we have top-notch equipment, top-notch personnel that can quickly get those who need help directly to a hospital or to a healthcare situation or facility as quickly as they possibly can.
This day has been a work in progress for several years. It's the result of 3 years of work just by the task force of the Illinois Ambulance Association. It's an example of what I consider good government and how the legislative process should work. This bill was a bipartisan product. It was bipartisan sponsorship in the House. We did not have an agreed bill yet when we were ready to move it to the Senate. All the stakeholders came together and we agreed on a Senate sponsor, and that was Senator David Koehler. And I talked to him last night to see if he was going to be here, and he couldn't, but he wanted to express his regrets. And he worked very hard on this and to get a negotiated bill. And it was a delight to work with him. As the governor said, he's an excellent legislator. All the stakeholders were at the table and had input, all negotiated in good faith. And we brought all the stakeholders together. Everybody wasn't coming from the same perspective, the same starting point. So we did not have an agreed bill, and the bill got better as we went on, as we moved ahead. This really was, I'll say, an industry initiative. It's a product. This legislation is from the ground up, not from the top down, and that's what makes it so good. With the governor's signature today, this takes a major step forward in providing even better health services, emergency care in Illinois. For the first time in our history, the level of care for a critical condition patient will be maintained during the transport between hospitals. That level of care will be maintained where it was. For the first time in our history, the level of care by ground transport will be equal to air transport for staff and equipment. And sometimes all that air care is, sometimes all of our choppers can be tied up or maybe grounded. That's why it was important. In addition, there's an item in here that gives the Department of Public Health the legal ability, if there's been a conviction, a juvenile sex offender or serious felony, they can revoke the license of an EMT, and that's going to be a change so that EMT licensure will match the other professions and will be able to deal with anyone that was convicted of those serious offenses. Because everybody worked together, this day is good for all citizens of Illinois, the entire state. Thank you all that worked on it. Thank you for all of you that work in this field for what you do. It's a great day. Thanks a lot.
We've got to have good ambulance service in every part of Illinois, because when a loved one or a coworker, or somebody you go to church with, somebody who's a neighbor on your block, when they have an emergency or you have an emergency, we want to get you to the hospital in a fast, prompt manner, and definitely have all the equipment and personnel well trained to help you save your life and go on with your life.